Welcome to resistance.Diet, a journey where science meets lifestyle choices. Join us as we delve into the intricate web of causes and risk factors contributing to this global health challenge. Get ready to explore, understand, and conquer the complexities of type 2 diabetes like never before. Number 1. Genetic predisposition. It refers to the increased likelihood of developing a particular condition, such as type 2 diabetes, based on a people's genetic makeup inherited from their parents. In the case of type 2 diabetes, multiple genes are involved, each contributing a small effect on overall risk. These genes influence various aspects of metabolism, insulin production, insulin sensitivity, and glucose regulation in the body. People with a family history of type 2 diabetes are at a higher risk due to the inheritance of genetic variants that may impair insulin function or increase insulin resistance. However, having these genetic predispositions does not guarantee the development of diabetes. Environmental factors, such as diet, physical activity, and lifestyle choices, also play crucial roles in determining whether these genetic predispositions manifest as diabetes. Understanding both genetic and environmental influences is essential for effective prevention and management strategies for type 2 diabetes. Number 2. Lifestyle factors encompass a wide range of behaviors and choices that directly impact health outcomes, including the development and progression. These factors include dietary patterns, physical activity levels, stress management, and sleep habits. Understanding how lifestyle choices influence type 2 diabetes involves recognizing their individual and collective effects on key physiological processes such as insulin sensitivity, glucose metabolism, and inflammation. High consumption of sugary beverages, processed foods, and foods rich in refined carbohydrates can lead to spikes in blood sugar levels, placing stress on the body's insulin response mechanisms. A diet lacking in fiber, fruits, vegetables, and whole grains can contribute to insulin resistance, a condition where cells become less responsive to insulin, leading to elevated blood sugar levels. Other genes may affect the function of insulin-producing cells in the pancreas, further contributing to the development of diabetes, while genetic predisposition plays a significant role. It's important to note that lifestyle factors, such as diet and physical activity, also heavily influence the likelihood of developing type 2 diabetes. Number 3. Obesity. It's a condition characterized by excess body fat accumulation, often resulting from a combination of genetic, environmental, and lifestyle factors. Obesity plays a pivotal role. Excess adipose tissue, especially around the abdomen, leads to insulin resistance, where cells become less responsive to insulin signals. Prolonged obesity can also lead to dysfunction of pancreatic beta cells, which are responsible for producing insulin. Over time, these cells may become unable to produce enough insulin to compensate for insulin resistance, leading to inadequate insulin secretion and elevated blood sugar levels characteristic of type 2 diabetes. Central obesity is strongly associated with insulin resistance, abnormal lipid levels, and inflammation, all of which contribute to the development of type 2 diabetes. Addressing obesity through lifestyle modifications such as healthy eating habits, regular physical activity, and weight management is crucial in preventing and managing type 2 diabetes. Number 4. Physical inactivity refers to a lifestyle characterized by low levels of physical activity or exercise. This can include activities such as walking, jogging, cycling, swimming, or participating in sports. When individuals engage in little to no physical activity, it can have significant implications for their health, including an increased risk of developing type 2 diabetes. Regular physical activity improves insulin sensitivity, allowing cells to better respond to insulin and efficiently regulate blood sugar levels. Exercise helps to maintain a healthy weight or reduce excess body fat, which is crucial in preventing or managing type 2 diabetes. Physical inactivity contributes to weight gain, particularly abdominal fat, which further increases insulin resistance and diabetes risk. During exercise, Muscles use glucose for energy. Physical inactivity reduces this demand, leading to elevated blood glucose levels because there's less uptake of glucose into cells. Regular exercise improves heart health and blood circulation, reducing the risk of cardiovascular complications associated with type 2 diabetes. Physical inactivity, on the other hand, increases the likelihood of developing cardiovascular issues, compounding the risks for diabetic patients. Number 5. Age and ethnicity. As people age, their risk of developing type 2 diabetes increases. This phenomenon is largely attributed to several age-related physiological changes that affect insulin sensitivity and pancreatic function. With advancing age, the body may become less responsive to insulin, leading to insulin resistance. Additionally, aging can also result in a decline in pancreatic beta cell function, responsible for producing insulin. The combination of insulin resistance and reduced insulin secretion can ultimately lead to the onset of type 2 diabetes. Moreover, aging often accompanies lifestyle changes, such as decreased physical activity and changes in dietary habits, which further contribute to the development of type 2 diabetes. Certain ethnic groups, including African American, Hispanic, Native American, and Asian American populations, have a higher predisposition to type 2 diabetes compared to others. This heightened risk is attributed to a combination of genetic susceptibility and environmental factors within these populations. For example, African Americans and Hispanic Americans are more likely to carry genetic variants linked to insulin resistance and impaired insulin secretion. Additionally, cultural factors such as dietary preferences, lifestyle behaviors, socioeconomic status, and access to healthcare services also influence the prevalence of type 2 diabetes within different ethnic communities. For instance, higher rates of obesity and sedentary lifestyles are prevalent in some ethnic groups, exacerbating the risk of developing type 2 diabetes. Each factor intertwines to elevate the risk. Recognizing these complexities empowers us to take proactive steps towards prevention. By prioritizing healthy habits and understanding the risk factors, we can navigate towards a healthier future, one choice at a time. Thanks for watching. Don't forget to like, share, and subscribe for more insightful content on health and wellness. Until next time, stay informed, stay healthy, and keep making positive choices. See you soon.